Hey, this is my NG video. This is my patient, Mr. Bear. He has a GI bleed, so he'll be getting an NG tube. All right, first things first, I'm going to compare my order with my MAR, check my physician's orders. I'm going to identify my patient, perform hand hygiene. I'm going to explain to the patient what I'm going to be doing. I'm going to go ahead and put on wash my hands and put on my gloves. So Mr. Bear is getting an NG tube, like I said, because he has a GI bleed. Yeah. So I'm gonna check his nostrils for patency. Next nostril, Mr. Bear. Breathe in, breathe out. Breathe out. They're both patent. Okay. So once that's done, I'm gonna make sure there's no issues with his nostrils. Everything looks good. I'm going to take my NG tube. I'm going to measure from nose to ear to the xiphoid process. That's where I'm gonna place my tape and get my measurements going. So once I've done that, I'm gonna go ahead and get him some ice chips. I'm gonna also get a basin and like a towel in case we have a mess. Okay. Then I'm gonna go ahead and lube up my NG tube, tell him what to expect. Tell him to swallow his ice chips as I'm doing the procedure. So yeah, my mind went blank. Yeah, swallow his ice chips while I'm doing it. I'm gonna stop if he has like any excessive gagging, any like excessive discomfort, anything too out the norm, too crazy. We're gonna stop. So I'm gonna pick the left nostril. So I'm gonna say, Mr. Bear, are you ready? He says yes. So yeah, I'm gonna go ahead and lube it up 3 to 4 inches. I'm gonna go ahead and go. Choo, 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 choo. He's swallowing his ice. Okay, I'm gonna temporarily tape it. And I'm going to, let's pretend like it's there taped. I'm going to check the placement by withdrawing gastric contents, and also I can do a chest x-ray. So let's say that everything looks good, everything's good to go. I'm going to permanently tape everything into place. And this whole time Mr. Bear is in high fiber position. I'm gonna document everything what I'm doing. So document this, the size of this, the nostril, that I, did the chest x-ray, the patency, that I did get some gastric juices back, and I checked for placement. Gotta make sure he's good to go and that everything is just great. So, in certain circumstances, there will be feedings that will be done through the NG tubes. So there's like continuous feedings, there's boluses, and there's gravity. So let's first talk about bolus. Now let's talk about gravity feeding. So the gravity, generally, I will have my formula and I'll pour it into here, and this will be hooked up to his NG tube, and it'll flow through gravity, and I'll flush it, of course, with 30 mils of water. And also, so for like a continuous feeding, I will have like a pump, and so I have my pump on. And with the pump, you have to change them out every 24 hours. You also get 30 mils of flush with the pump every 4 hours. And you also need to check the residuals with these feedings. So okay. So if you get like 250 or less, then you're fine. But if you get 500 or more at once, or 250, more than 250 2 times within the hour, or at an hour, somewhere around there, then you need to stop the feeding because that's too much residual. Okay? So those are my feedings. And then bolus is similar too. You just it gets 30 mils of flush, and it's intermittent. It's not gravity and it's not continuous. It's just like a supplemental feeding. So yes, so if I was wanting to do my continuous, I'll of course hang my bag, has to be changed every 24 hours. Make sure it's set up right. If I ever need to stop it, I need to make sure that I clamp it, everything's like disconnected, it's off, that kind of thing. What else about my feedings? I think that's pretty much it with my feedings. So we can go into removal. So Mr. Bear has his NG tube in, his GI bleed's all better, now he can go home. Or he still has to be here, but his GI bleed's over. So removal is pretty simple. I'm gonna make sure I have the right patient, verify my order, get my supplies. I'm gonna wash my hands, put on my clean gloves, make sure that any feedings or anything going is stopped, clamped, off, done. I'm going to ask Mr. Bear to bear down as I remove the tube. So I'm going to do it pretty swiftly but steadily, so there's not too much discomfort. So Mr. Bear's going to bear down. I'm going to remove the tube slowly. Also, I'm going to have the basin there and the towel there while I'm doing this. I'm going to remove the tube. I'm going to do, nasal care. After I remove the tube, make sure everything's good, no perforations, nothing crazy. I'm going to make sure he's good to go and just document everything, document the removal, any contents that I got during the removal, how he tolerated it, and that's pretty much it.